Hello students, today we will start with a new subject, that is your pharmacy practice, which is introduced by the PCI for the first time in your syllabus. So before digging into the syllabus, just we will take a look what is pharmacy practice regulation, what is uh, the root of coming into the India, and what are the objectives and what are the understandings by these regulations. So first of all, it is main important that the pharmacy practice regulation is 2015 regulations which come into the Indian organization. So what is pharmacy practice? We will just see in later. The Government of India on January 2015 issued a notification which is entitled the name Pharmacy Practice Regulation 2015, and the main aim of these regulations come into force is to enhance the status and the practice of the pharmacy professions in the country. Before also, the pharmacy practice is working. Pharmacists are working, pharmacy courses are working, but these regulation main focus is to enhance the status. Whatever the status is of the pharmacist in the present condition, it has to be enhanced and their practice of the pharmacy profession in the country. And these regulations are the first comprehensive changes introduced to the outdated provisions in the laws governing the pharmacy practice. Okay, though though the pharmacy practice is concernedly regulated by the Pharmacy Act and the Drug and Cosmetics, which is notified by the central government several decades ago. So these regulations, this pharmacy regulation 2015 is been come on over of these central government regulations. Okay, so basically the meaning of the act, the meaning of the act is for the interpretation, evaluation, and implementation of the medical orders. Whatever the orders are we getting in a hospital, in a community, or in a clinic, it has to be evaluated, interpreted, and dispensing of the prescription or drug order in a right way, in a right dose, in a right time has to be given to the patient, and the dispensing, compounding, and administrations of drugs, participation of drugs, services, these are also are forcefully meant for the Pharmacy Act. Main focus on the patient counseling, patient care, and pharmaceutical care. What do you mean by pharmaceutical care? Pharmaceutical care means the provision of drug therapy and the patient care services intended to achieve the outcome related to the care or the prevention of the disease, or the elimination or reduction of the patient's symptoms, or arresting or slowing of a disease process. This is a pharmaceutical care which is most important to take care by the pharmacy practice person. So this is a notification given by the government on January 16, 2015 for the pharmacy practice regulations. This is a notary, screenshot of a notary. So basically we will discuss the pharmacy practice in one by one. We have seen here the meaning, and then we will discuss later on. First is your dispensing. It is in a previous years also the pharmacy is dispensing, but here we are focusing more. So for dispensing, the regulation says the interpretation, evaluation, supply, and implementation of a prescription drug order, including the preparation and the delivery of a drug or a device to a patient or patient agent in suitable container, appropriately labeled for subsequent administration to or use by a patient. Whatever the medicines are being dispensed, it should be labeled properly so that the patient can take it in a good manner. Next is the distribute of a drug. The delivery of the drug or the device other than by administering or dispensing is to be more focused by a pharmacist. Third is your patient counseling, which is most important in for making a communication with the patient, with their family members, so that you can get a more information about the patient for the treatment, for diagnosis of the disease. So the patient counseling is most important before the diagnosis and after the diagnosis of the disease. Because after diagnosis, you have to give the communication to the patient about the disease, what the disease is occurred to the patient, and the medicines which is being given to the patient, how to take the drug, when to take the drug, how much to take the drugs, route of the drug. Okay, so the oral communication by the pharmacist of information to the patient or the caregiver in order to ensure the proper use of the drug and the devices, which is most important. Pharmaceutical care, it is already been discussed in a previous slide. I will. It is mainly a centered practice in which the pharmacist assumes the responsibilities for a patient's drug-related needs and help in the prevention, elimination of the reduction of the patient's symptoms or the disease. The most important main aim of the pharmacy practice person is to reduce the patient's symptoms or to eliminate the disease or to reduce the disease. Next is your pharmacy practice now. What the pharmacy practitioner and what are the rules? An individually currently licensed, registered, or authorized under the Pharmacy Act to counsel or administer the drug to the patients. They are pharmacy practitioners. They are registered pharmacists. Registered pharmacists can be a community pharmacist, which are supplying the prescription medicines and provide the device and the information on the people's health, and can be a hospital pharmacist, which is in the pharmacy, in the hospital. The pharmacy is in the hospital and dispensing the drug to the patient and advising them about the medicines. Next is your clinical pharmacist. The most important role of the clinical pharmacist is to optimize patient care, to optimize the use of medication and promote the health, wellness and disease prevention. They work in collaboration with the physician and other healthcare professionals and also provide a major guidance to them about the drug interactions, drug monitoring, drug information centers. Next is your drug information pharmacist, which provide the information and advice regarding the drug interactions, the side effects of the drugs, dose of the drug, proper medication storage of the drug to the patient and other health professionals. It only not focus on the patients. They also focus on the patient families, other healthcare professionals to improve the safety of the drug. Next is your code of pharmacy ethics. What are the ethics is to be followed, and because these regulations came into the country, it will maintain the uniformity in all over the world. So first ethic is to take care the patient care, first concern of the pharmacist. The pharmacist should be honest and trustworthy and be responsible for the colleagues and other health professionals, upgrade their professional knowledge and be competent with other pharmacists. respect and support the patient's individuality, dignity, and confidentiality. It is most important maintain the patient record and does not engage with the illegal and unethical conduct that will credit their professionals and rent or lease the pharmacy registration certificate. It is a very strictly prohibited. Next is your most important, displaying the name of the owner and the registered pharmacist. So, every registered pharmacist should display their name on the main entrance of the premises or the building. The registered pharmacist display his or name on the signboard along with the educational qualification, registration number, and the photograph. This is the example, the photograph of the pharmacist, and here there should be a badge. A pharmacist should wear a clean apron which consists of badge, and the badge should have the name and the registration number. Next, what are the duties and responsibilities of the pharmacist? Should provide medicines which is to be cost effective health therapy. Cost effective means good medicine in a low cost so that local people can also purchase and get rid of the diseases. Safe and rational use of the drug. Third duty is to patient counseling, to provide the counseling about the drug to the patient or their caregiver. Fourth is your formulator, distributor, compounding of the medicines, means manufacturing related work. So fifth is your pharmaceutical care. Sixth is your provide healthcare education. If there is a new drug is coming into the market, the role of the pharmacist is also to provide the knowledge to the healthcare professionals day by on a daily basis. So according to this, we have a good pharmacy practice. So in a good pharmacy practice is being implemented so that although pharmacy practice should use these GP for their practice in a standard way. There should not be a deviation of the standards or the ethics. So the membership in the association is for the advancement of the pharmacy profession as a part of continuing pharmacy education program. So it should be done by every person for the maintenance of the patient records for about period of 5 years from the date of the commencement of the treatment. We have to take the record, computerize medical records for the quick retrieval, exposure of unethical conduct. The patient pharmacist should expose the incompetent or the corruption, expose the dishonest or unethical conduct, highest quality assurance in the patient for the so that it will help in safeguarding the professions against those who are deficient in the moral character or the education. Next is your renewal of the registration. When a pharmacist should renew his registration. For the renewal of registration, the pharmacist shall attend a minimum 2 refresher courses in the pharmacy of minimum 1 day duration each in a span of 5 years, which is organized by the Pharmacy Council of India, State Pharmacy Council of India, central government or a state government, or other professional bodies which is recognized by the council. Okay. This pharmaceutical care, you have already seen what are the responsibilities of the pharmacist. If we will see the syllabus, so whatever the ethics, whatever duties, what are the aim of the pharmacy practice regulations, we are going to read in our syllabus. So unit first is all about the hospital because all the practice is starting from the hospital. So you have to know all the things about the hospital. What is hospital? The classification of hospital, how the according to the bed size, according to the patient, how the hospital are classified. Okay. So, and about the organizational structures, what are the government bodies, what are the board of trustees, how they are working, what are their functions, whatever the medical staffs are working in the hospitals, what are their responsibilities, what are their functions in the hospitals. Next come the hospital pharmacy. We have learned about the hospital. Now the pharmacy which is in the hospital, we should also know about their layout, whatever, what where it has to be located, what are their functions, what are their organization structure of the hospital pharmacy, what are the staff required in a hospital pharmacy, and their responsibilities, duties, and the function of the hospital pharmacist. After seeing the hospital and the hospital pharmacy, we have to check all the drugs which are giving to the patients do are not causing any of the drug reactions. So to monitor the adverse drug reaction, we have to read about all the classification of the adverse drug reactions. There are different classification. We have to read it, and their drug interactions. Their drug interactions also been read by the in this course, and the interactions, adverse drug interactions, pharmacokinetic drug interactions, and what are the methods to detect the drug interactions, what is a spontaneous reporting of the patient, matlab, if the patient is having an adverse effect or a reactions, how they are recording, how they are reporting. Okay. Next is about the community pharmacy, organization structure of retail, wholesale, drugstore. What are the types? What are the design? What are the legal requirements for the establishment and the maintenance of the drugstore? Dispensing of the property products. What are the maintenance of the records or the retail or the wholesale? In the second unit, with this in the second unit, you all are going to read about the uh, in one first unit you have read about the hospital. So in the hospital, how the drugs are distributed. So here you are going to read about the drug distribution of the hospital, how they are distributed in inpatients or in IPD or the OPD, what are the labeling parameters. About the hospital formulary. Hospital formulary is a list of drugs. What are the emergency drugs when it has to be given to the patients. So these are the individual. It will vary from one hospital to another hospital. Every hospital has their own formulary, own guidelines, how they are working. Next is your therapeutic drug monitoring, monitoring of the drug with their factors. Uh, according there are different factors which affect the drug efficacy or the therapeutic response, like the age, what are the age factor, disease factors. So here we are going to read about the drug monitoring. Medication adherence. Medication adherence means how the patients are compliance to the drug they are taking or not taking. So what are the role of pharmacists for the medical adherence. Next is your patient medical history interview, how the patient has to take the history interview of the patient. Community pharmacy management, what are the financial, material, staff, infrastructure requirement for the pharmacy management. Next unit is your unit third, in which you have to read about the pharmacy and therapeutic committee. There is a committee of the pharmacy, so there is an organizational board of trustees in a hierarchy manner. So we are going to read about all that, and the drug information services like drug and the poison information center, sources of drugs where we are getting patient counseling and education and training programs in the hospitals, what are the role of the pharmacist, and the prescribed medication order and communication skill. Next unit is your fourth unit. In this unit, you will cover all the clinical pharmacy portion. how the patient clinical pharmacist work in he the clinical pharmacists work in the major responsibilities and the functions, what are their duties, like how they have to monitor the drug, medication, how to prepare the medication chart, clinical review. In the last unit, we will see the drugstore management and the inventory control. So, how the pharmacist is maintaining their records and what are the inventories, how they are maintaining on the HAT table, and we will see investigation use of drug, their description, their classification, their control, identification, and role of pharmacist on the advisory committee. And last, we will see the laboratory reports to see the clinical laboratory test. So for that we are going to see on the blood, hematology and urine analysis. Thank you. This contains the introduction of your pharmacy practice.